So if you are suffering from an acute bout of sciatica, it's very unpleasant. And the obvious thing that you're going to think is, how long is this going to last? Well, I'm going to answer that question, kind of, in this video. Now, there are a whole manner of reasons why people can experience sciatica and a whole different load of causes of why you can get pain in your leg and it's quite severe. You're unique as an individual. Your circumstances are unique, what you do on a daily basis and your physiological makeup. But there are some factors that I've seen in my 25 years of clinical practice that can influence how long you can have sciatica, how long you seem to have it for. And so these are the factors that I've seen that can make a difference in terms of how long you're likely to have it. So the first factor to consider is how long you've already had the symptoms. How long have the symptoms already lasted? Has it been just a couple of days that you've been experiencing this severe pain, or have you been experiencing it for weeks or possibly months? Hopefully not years. The longer you have had it, the chances are the more adaptations that have taken place and behaviours have taken place that has influenced the fact that all that needs to be undone and in order to get rid of it. So the longer you have these things, the more compensations that we make that make life a bit more difficult to actually get rid of it in the first place. So another factor I've seen is whether it came on suddenly or whether it gradually came on. So suddenly would be like you went to lift something heavy and all of a sudden the back went or the leg symptoms started, compared with I started to develop these symptoms in my leg. I noticed them a little bit at first, but then they got worse and worse and worse. If you experienced the former and actually it was an acute onset, funnily enough, I think it gets better a little bit quicker because, again, you haven't had the opportunity to develop all these bad habits and these compensations that can make the situation prolong. So if you do the right things at that stage, then actually you can get better much quicker. If it's more of a gradual onset, it can sometimes mean that something in terms of posturally or muscle-wise or behaviour-wise has developed over a period of time that eventually, it's like the straw that broke the camel's back, has then pushed over into symptoms. And that can be, again, take a little bit of time of just undoing some of those factors to get some relief. Another thing to consider is pain severity. If you are in acute levels of pain and finding it very, very difficult to move at all, then that's not a great scenario for actually being able to do rehab and to improve the situation. So if you have less symptoms, you tend to be able to move, and providing you get the right advice about rehab, can help you to get better a bit quicker. Now, another factor is the degree of neurological involvement in your symptoms. So obviously it's possible to have back pain, leg pain, but if you have neurological symptoms as well, which is pins and needles, numbness sensations, things like weakness in a foot, then that can indicate it's more likely a nerve root problem from your lower back, possibly related to a disc, but it can mean that the symptoms are a little bit more severe than perhaps just a leg pain or ache in the back. And so if you have neurological symptoms, it can be a sign that things are perhaps a little bit more severe, and so therefore might take a little bit longer to get better. If you've had a previous history of lower back symptoms or sciatic symptoms, and this is just another episode in the long line of problems, again, it would be an indication that you have something perhaps that's a little bit more underlying in terms of weakness, muscular differences or movement differences that is causing these irritations to happen, and they need to be undone. They've probably well ingrained, been there for a long time, which means that you're probably going to need a little bit longer to get over. If you've had a previous history, it can mean it takes a little bit longer. But if it's your first episode, then you haven't necessarily had those opportunities to get those maladaptive behaviours, and therefore it's probably going to get better a little bit quicker than otherwise. I'm afraid age does come into it, okay? We can't do anything about it, we're all aging, We all get older from the moment we're born. Certainly the older we get, the more potential degenerative changes like a loss of disc height, wear and tear to some of those joints, weakness to some of those muscles, and behaviours that causes us to move in certain ways that might predispose us to problems. The older we get, the slightly more difficult it is to get rid of sciatica, although that's a general rule. It's not a hard and fast rule. And finally, it's worth noting that how easy it is for you to find a comfortable position can also be an indication. If you find it really difficult to find a comfortable position which relieves your symptoms and reduces perhaps your leg pain, then it's more difficult to then settle those nerve symptoms down and actually to progress. Whereas if you are immediately able to find a great position which helps to relieve your symptoms, then that can be a good sign that you've only got one direction of movement problem to deal with, and it's likely that you're going to be able to get better with the right advice and improve things. So with that context, all these factors and many more come into the equation. If you want some help finding a comfortable position, then have a look at this video where I outline some common positions which help to relieve leg pain related to sciatic pain.